Welcome, everybody. Welcome back to this distinguished seminar series that we're running from Purdue University along with CIB, which is the International Council for Research and Development in Building and Construction. And today's speaker is Mr. Ali Morshedi Shahribabki. And let me read a little bit about his accomplishments so far. And he's going to present a very interesting research topic today that relates to his research. So he's currently a doctoral candidate at the Lyell School of Civil Engineering at Purdue University. He earned his bachelor's and master's degree in civil engineering from Sharif University of Technology in Iran. After graduation, he worked for 3 years at the Center for Infrastructure Sustainability and Resilience at Sharif. During this time, he worked on developing simulation-based decision support tools to understand the housing market dynamics in response to seismic retrofit promotion policies. During his tenure at Purdue, Ali has actively participated in various research initiatives, both funded as well as non-funded. These efforts have resulted in multiple journal publications, conference presentations, and recognitions. His research is centered around incorporating social economic factors in measuring the resilience of communities in the face of natural hazards. His expertise spans diverse areas, including risk analysis, community well-being, statistical simulation, and machine learning models and steel structures. Recently, he has been named Lyell's Graduate Teaching Fellow by the School of Civil Engineering at Purdue University. So please welcome Ali Morshedi. Ali?
Hello, everyone. Thank you for joining today's seminar, and thank you, Professor Hashtag, for the nice introduction. As Professor said, my name is Mohamadali Morshedi. I'm a PhD candidate at the Lyell School of Civil Engineering, and I work with Professor Hashtag, and it's my pleasure to be able to present the results of my dissertation research so far on the role of social infrastructure and the role that they can play in improving community resilience and post-disaster well-being. And today I'm going to focus more on the results of a case study of Hurricane Harvey. So I would like to start with a bit of introduction about myself. My name is Mohamadali Morshedi Shahribabki, because it's long, people call me Ali for short. I am originally from Iran, Kerman, and it might be interesting to know that there's a small city in California with the exact same name. I got both my bachelor's and master's in civil engineering from Sharif University of Technology. And during my master's, I figured I'm looking for, my research may lead to a small change in one coefficient in a building code, but I was looking for a more tangible and a bigger impact on society. So that's why I applied for Purdue and then started working on, the social factors in community resilience. So today I'm going to talk about, to define the problem, what we're talking about, and then mention the gaps in the literature. Then I'm going to talk about the needs, scope, and methods of my research, and talk about some of the preliminary results that I've been able to get so far, and then close with some thoughts on the merits and the broader impacts that my research can potentially have on community resilience. So if natural hazards frequency is growing because of climate change, if we just look at the first half of 2023, as you can see in the map, there are numerous hazards that are happening across the globe, and they have caused more than $100 billion of loss, half of which is insured. And if we just look at the United States, and in this table, you can see the billion-dollar hurricanes that have happened in this millennium. And just by looking at the years, you can see that the frequency of hazards is increasing, because 6 out of 8 of these billion-dollar hurricanes have happened over the past 5 years. And all of them have led to huge economic and life losses. And as you can see in this table, so the hurricanes can cause short-term impacts, such as disruptions in transportation systems, power outages, loss of communication, and then all of this can lead to limited access to food and water in the short-term period after a disaster. And then there are also long-term impacts, which is actually the focus of my research, which can be economic impacts, that can be about job opportunities, affordability issues, and housing problem, social impacts such as stress, depression, anxiety that turn to show later on after the disaster, and then these two can cause even people to displace from their original place of residence. So, and the problem gets worse whenever we understand that these social impacts are disproportionate across different community members. So research on Hurricane Harvey showed that flooding was worse in neighborhoods with more Black and Latino residents. And also a longitudinal study on $3 billion hurricanes in the US showed that these hurricanes have led to higher displacement of vulnerable people. And then the neighborhoods were smaller and then more white after those three disasters. So, and such hurricanes had led to an increased level of socioeconomic polarization. But how can such impacts be mitigated and at least alleviated? So, social support after disaster can help communities to address some of these negative impacts. Just taking a look at the example of Hurricane Ida, both governmental and informal social network had a huge role in post-disaster recovery. For instance, FEMA employees and Red Cross volunteers helped with sheltering people, providing power generators, and also meals and water. And also informal social network helped with the search and rescue process by offering the trucks and boats, and then sharing the information on Twitter or Facebook, and of course, providing emotional support for those who survived the disaster. So, but there is a need for us, a paradigm that allows us to quantify the role that social support can play in improving community resilience and increasing post-disaster community well-being, which is the focus of my research. So talking about the gap in the literature, in this graph, you can see the traditional recovery curve. And then usually the functionality metric or the performance metric after disaster is the functionality of civil infrastructure. But there are two problems with that. First, the problem is that the recovery of civil infrastructure is not necessarily equivalent to the recovery of a community from disaster, considering the long-term social and economic impacts that we just talked about. So, and the other limitation is that there are other layers of infrastructure system. So as established in our research group for over more than a decade, there are 7 layers of infrastructure systems that are interconnected and play a role in the recovery of communities from disaster, namely civil, civic, cyber about communication, social infrastructure, which is the focus of my research, which is about NGOs, community centers, and religious centers that can help alleviate the social and economic impacts after disaster. Financial layer, providing disaster assistance after disaster, educational, being able to educate people about disaster, and environmental layer, which is natural barriers that can help us to perform better for floods. So just to provide an example that the recovery of civil infrastructure is not necessarily equivalent to the recovery of the community, just let's take a look back at the COVID period. So over the past 2 or 3 years, I would say civil infrastructure system has been functional, but there is huge social and psychological impacts such as grief because of loss and anxiety on community members. And so we cannot say that community is back to normal or in pre-COVID area condition. So, and there is also ongoing economic impact that seems to be difficult to recover from. So just to provide an overall view about the needs and the gaps in the existing literature, engineers tend to should consider more community well-being as the ultimate goal of building engineering objects, and then social scientists needs to focus more on the dynamic models for quantifying the role of civil infrastructure in community resilience and community well-being. So the goal of my research is to develop a dynamic model that can quantify post-disaster community well-being, and this allows us to consider both short-term and long-term impacts. So this slide kind of is schematic, shows kind of a schematic overview of my research. As I said, I'm proposing a new metric for the functionality of communities after disaster to consider to incorporate those social and economic factors. And that metric is post-disaster community well-being, normalized with respect to pre-disaster situation. And on the right-hand side, you can see that I start with quantifying community well-being and defining it based on 6 different domains. And then next step is to link the functionality of different infrastructure systems, particularly social infrastructure and community well-being. So we try to see how service disruptions in each of those layers is going to affect community well-being. And then I am looking to quantify the impact of adding capacities and the functionality of infrastructure systems. So to be able to build capacities to perform better in the face of future events. So the focus of my research is on hurricanes. Today I'm going to talk more about Hurricane Harvey results, and then we do the study at the zip code level, and the time scale is daily and up to 6 months after Hurricane Harvey. And then the infrastructure framework that I'm using is the 7-layer framework introduced in our research group. So, and this is a demonstration of the 7-layer infrastructure systems. And as I said, the focus of my research is in the role of social infrastructure, which is about community centers, NGOs, religious centers, the role that they can play in alleviating social and psychological impacts after the disaster. So this slide shows the methodology of my research. So there are 3 different modules. And the first module is about modeling the functionality of social infrastructure. The second module is quantifying post-disaster community well-being. And the third module is trying to find the optimal capacity building strategy. So the first module takes infrastructure capacities as well as hazard exposure, evacuation orders issued before a hurricane, and then provide the amount of social support provided after disaster as an output. So module 2 takes the amount of social support provided as an input and then provides community well-being as an output to module 3, which then through an iterative process determines the optimum capacity building strategy. And a byproduct of module 2 is disparities in community well-being. So we want to see how people from different locations and from different socioeconomic backgrounds are affected measured by the amount of reduction in their post-disaster community well-being. So let's get into some of the results. So today I'm going to talk about the case study of Hurricane Harvey. So in this case study, I tried to model the impact of social support on community well-being. And this is more about module 1 and 2. So the main method that I used was Bayesian Network Analysis, so which allows us to have an interconnected module 1 and 2. And the main variables that I can consider are the infrastructure capacities measured by the BRIC index, which is the baseline resilience index score for communities, which is developed at the University of South Carolina, and recently has been incorporated into FEMA's National Risk Index. So I use that as to measure the capacity in communities. So what I try to do is quantify community well-being, see how social support is going to affect and help us have high level of community well-being. So, and this social support can have different types and can be provided by different sources. So it can be tangible, meaning the provision of financial support, food, water, shelter even, and then emotional and informational. It can be from different sources, as I mentioned, governmental sources such as FEMA and maybe Red Cross, and also informal social networks. So we want to see what is the level of social support that we need to achieve, let's say, high level of well-being after disaster. And then in order to be able to mobilize that level of support, what are the capacities that we need? So these are the questions I try to answer and understand based on this case study. So this slide shows the research method. So it starts with the data collection. So there are 4 primary data sources that I use. The most important ones are the 211 call data, which is an emergency helpline that was active after Hurricane Harvey in the Houston area. I will later explain how what about each of these data sources. And I also use the data collected through a survey questionnaire that was administered to the households that lied on the path of Hurricane Harvey. And so I use all these data sources in order to be able to quantify community well-being based on 6 different domains and a number of indicators. So step 2 is about measuring the damage to each zip code. So what is the level of damage to each zip code after a hurricane? So in order to quantify the damage to each zip code, I use FEMA IHP data. So this is Federal Emergency Management Agency data that collects information about the households that were eligible for financial support and other types of direct supports. And the data also collects information about the needs of population, about for food, let's say shelter, whether they have experienced utility outages, and so on. So I use FEMA data to measure the level of damage to a zip code, and I use the survey data and 211 call data to quantify community well-being. And to kind of make sure that the causal relationships that we had envisioned to be true are actually true for the data set that we had created. They hold for the data. We used Pearson correlations to make sure that those actually hold for the data. Then, as you might know, for the Bayesian network analysis, we need to have discrete variables. So one part of the processing of the data was to convert continuous variables to discrete variables using k-means clustering. And then I did a cross-validation to make sure that the Bayesian network can actually predict the level of community well-being after disaster. And then I'm going to talk about some of the data analysis results. So starting with the 211 data. So as I said, there was a disaster helpline that was active in the area of Houston. So the system was 24/7. The data that collected is actually the topic of the calls. And the number of calls with respect to different topics over 1 month after Hurricane Harvey. The data is aggregated at the zip code level, and there are more than 18 topic categories. And just to provide a sense how the data looks, so there are different topics and then different subtopics that were used as indicators to quantify community well-being. One of the topics is disaster services, and then there are different subtopics under that broad topic, that can be about disaster food stamps, about the shelters, and then loans. So I use the number of calls with respect to each subtopic as indicators to quantify community well-being. So the second data source that I use is data from a survey questionnaire that was collected as a result of a NSF project, resilience and recovery of interdependent social and physical systems. So the survey covered more than 700 households from 51 zip codes that were affected by Hurricane Harvey. And but the survey tried to actually gather and collect three main pieces of information. The first part was about the damage to the home of the households and then the community at the different times over time after Hurricane Harvey, up to 3 years. And then the recovery of community services, different services, and then social relationships over time. And then the most important piece of information is the amount of support provided to each household from different sources. So households reported their level of support that they have received after disaster over time. And I use that information to as an input to the Bayesian network model. So to model community well-being, I use bottom-up spillover theory, which is kind of a hierarchical way of modeling community well-being. So in order to measure community well-being, we measure the satisfaction of people with different domains. And in this case, I propose 6 different domains and 23 subdomains, 69 indicators based on the existing literature on community well-being. So in order to provide a sense of how each domain and subdomain looks like, I'm going to provide some details about the services, satisfaction with services subdomain actually. So as you can see in the table, there are different subdomains, which is satisfaction with transportation and mobility systems, drinking water, electricity, affordable energy, how the built environment looks, and then there are some indicators under each of these subdomains. So I use 2 of the survey questions, which ask about the recovery status or functionality level of school and childcare, as well as medical facilities, as a proxy for the satisfaction of people with respect to transportation and mobility. I also use the 211 call data, as I mentioned. So the number of calls that were mentioning the needs for assistance for paying the utility bills after Hurricane Harvey, normalized with population, was taken as an indicator to measure the satisfaction of people with affordable energy supply. And then all of them contributed to that domain, and each domain contributed to the overall well-being. So in using 211 call data, there were 2 main challenges. The first of all, that 211 call data is limited to Houston area, whereas the survey data covered 51 different zip codes all across Texas. And the second challenge was that power outage is going to affect the number of received calls. So there's no phone call system functional so that people can use to call. So in order to address those two challenges, for the first challenge, I use FEMA individual and household program data to expand to one call data to other zip codes, basically trying to project what would have been the number of phone calls with respect to different topics in the zip codes that do not have that system, right? So, and I later explain how I did that. For the second challenge, I used the zip codes with a low level of damage, so that those zip codes are those with the lower level of damage to the phone line systems, so that the number of calls is actually a better representative of the actual needs of the community. So in order to be, and by damage, I mean, I use FEMA, IHP, individual and household program variables to actually identify the level of damage. And so since the variables are highly correlated in that data set, I use principal component analysis to identify two main principal components. So the first one, and they turned out to have actually meaningful, insights. So the first principal component covered mostly financial aspects, and the weight of those financial factors were negative for the second component. And the more weight was given to utility outage, distractions, not having access. So the second component was more about service disruption. So by using the zip codes with the low level of damage, and which I try to address the problem with the unavailability of the phone call system. So as I said, just to provide an example, how I use 211 call and FEMA HP data to expand 211 call data. So in the vertical axis, you see the 211 call topic. So there's a topic called category of topics about food and agriculture, and we have a FEMA HP variable which is about food need. And here in this, you can see there is a clear correlation between the cluster that had a low level of damage, and then also the similar kind of relation holds for healthcare. So there were 211 call topics about healthcare, and there was a emergency needs variable in the FEMA HP data. As you can see, there's also a good correlation. So I followed the same strategy and kind of linked 211 call topics to their associated FEMA HP variable. For instance, if we look at affordable energy, which is a 211 call topic, we have a FEMA HP variable, which is utility outage. And then for emergency services, we have both those variables. So using that, I was able to expand 211 call data, basically project 211 call numbers under different topics for different zip codes. And then I later assigned this value between 0 and 1 to each of these topics that later on served as indicators to quantify subdomains and then community well-being. So, and if we aggregate these core values for those indicators, we can get the subdomain scores. And as I said, there are 23 subdomain scores. So you can see the time trends for only one of the zip codes as a sample. But I did this for all the zip codes that we had. And if we further aggregate these subdomains into one metric, which is community well-being, this is how it's going to look like over time. So these are the well-being trends over time, and these are quantiles: 10%, 25, 50, 75, and then 90% quantile of the data. So the worst 10% of the zip codes are these two that lie in the path of hurricane and were coastal zip codes. And there are some also best performing zip codes. But looking at the time trend, temporal trends of community well-being, we can see that there is a sudden drop on the onset of the hurricane, followed by a short-term recovery, then a secondary decline, and then secondary recovery. And I tried to figure out what are the factors that contribute to this huge decline. So by looking at the radar chart at the right-hand side and looking at the red line, you can kind of figure out that the issues with the health, services, environmental, and then social and psychological were the main domains that were affected the most just right after Hurricane Harvey. So there were utility outages, transportation system was not functional because of huge flooding, and then there were problems with garbage and debris that affected environmental domain. Health domain was affected because of emergency services and the need for food. And of course, social aspects because of the shock of the disaster, and then the need for crisis counseling. So there were huge number of calls to the 211 system asking for crisis counseling right after Hurricane Harvey. So then if we move on to day 50, where we observe the secondary decline, we can see that comparing the black line in the radar chart with the red line, we can figure out almost all the domains recovered except for economic and social. And the economic has not recovered because of the repair expenses, mortgage expenses, unavailability of appropriate housing units, and also high utility bills that were issued after Hurricane Harvey. So later on, 6 months after the disaster, almost all of the domains had recovered to a good extent, except for social domain, which is because of a lack of social interactions and then long-term social impacts such as PTSD, anxiety, and stress on the community members. So I would like to take a moment and let's take a look at the geographic distribution of these recovery quantifiers. So as I said, one of these, the coastal zip codes that was actually the landfall of hurricane was damaged the most and was among the lowest recovery quantiles. But we have another zip code that is also close to the path of hurricane, but belongs to the faster recovery quantiles. And a part of that is because of higher level of social support after disaster. And in order to actually formally evaluate that, I developed the Bayesian Network Model. And so the purpose of Bayesian Network Model was to see, in order to have high level of community well-being, what is the amount of social support that I need? So what is the threshold for tangible support, emotional support, and informational support from both governmental and informal social side that I need to achieve high level of community well-being? But we need to also consider the amount of zip code damage. So basically develop damage support profiles and see the impacts on community well-being. And as I said, in order to be able to mobilize, the level of support that is required to achieve, let's say, high level of well-being, we need to have the capacities in the community. So what are the thresholds for the capacities? What kind of capacities do we need to be able to mobilize the level of social support that we need to be able to achieve a higher level of post-disaster well-being? These are the questions that I wanted to show you how I answered in my dissertation. So in this graph, you can see the impact of support on community well-being. So these 3D plots at the first row kind of shows the impact of tangible, emotional, and informational support from both organizational and informal social ties on community well-being. As you can see in the charts, the more the tangible support from organization, the higher the tangible support from institutions, you're going to have a higher level of well-being. But there are some thresholds that I identify using the Bayesian Network Model, and then basically using the discretization process that we followed. So, and again, in the first bottom row, in the second row, actually, the bottom row, you can see the probability distributions. These are basically showing what is the probability of having low, medium, high, and very high level of well-being for different support profiles, low level of support, medium, and then high. And as you can see, as the level of support increases, there is a shift in the probability distribution of community well-being. So we are expecting to have high level of well-being if we provide more level of support. So, but what is the impact of providing more support on the temporal community well-being or recovery with respect to community well-being over time? That is what is shown in this slide. So as you can see, if we compare the zip codes that had received low level of support versus high level of support, denoted by green and red colors, you can see that zip codes that had a higher level of tangible support, or in other words, zip codes with lower level of tangible support suffered from long-term impacts. And with respect to emotional support, although the magnitude of the impact was bigger, but the impacts were temporary. And then this talks about the amount of social support and not considering the damage. But what if we are to consider the damage as well? So these are the damage support profiles that I talk about. So the dashed lines pertain to the low level of support, and the solid lines are for high level of support, right? And the green is for the situation then we have low level of damage, and red colors is for the zip codes that have high level of damage. So as you can see, the differences are more pronounced for the zip codes that have a higher level of damage after fire. So those zip codes, the green colors, as you can see, the existence and lack of social support does not matter that much. But for those zip codes that had a high level of damage, as you can see, the impact of support of different kind have more pronounced impact. So we need to mobilize some level of support, but what are the capacities that we need? So that is what I'm trying to answer here. So if we compare the zip codes that had a high level of support versus low level of support, in the right hand graph, you can see that those zip codes with high level of support, those are the ones that had higher capacity with respect to infrastructure domain, economic domain, and social domain, and also interoperability, which is how well different entities and organizations are able to actually interact with each other to prepare emergency response activities under post-disaster situation. And going back to those two zip codes, we can see that these two zip codes that we were comparing, the level of support for one of the zip codes is that belong to the higher recovery quantile is much higher as compared to the other zip code. So, and we expanded the results for the whole Texas area. So we know to be able to understand what are the zip codes that have adequate infrastructure capacity and social capacity, the bottom row, for a low damage scenario and high damage scenario hurricane in the future. So if we look at the right-hand side slide, which is for the high damage scenario, we can see that we can notice that these areas that are close to, that are urban areas basically, have adequate infrastructure capacity to be able to have a high level of well-being after a future hurricane. And those areas, those same areas actually lack social capacity. And social capacity exists in mostly rural areas. So the solution would be, so the recommendation is to build social capacities in urban areas and infrastructure capacities in rural areas. But what do I mean by infrastructure capacities and social capacities? So by infrastructure capacities, I'm borrowing this from the BRIC index for community capacities. So in order to have a high level of infrastructure capacities, there are four main ways. So the first way is to improve the robustness of housing units, having lower mobile homes, having the housing units that are built after 2000, and then less housing units that were built before 1970. In order to also improving sheltering capacity is a way of mobilizing social support. So if you have more public schools, hotels, and vacant rental units, you can assign them as temporary shelters and then centers for distributing the support that we are looking for, particularly tangible support. And then the results also show that the zip codes with denser road network were able to distribute the support faster as compared to those that have a low density road network. So that is one of the other infrastructure capacity building strategies. The other factor was high internet speed infrastructure. So people could, so a high infrastructure, high speed internet infrastructure allows for, facilitated flow of information can help with disseminating the disaster information, but also emotional support. People can reach out to each other and then provide emotional support if the internet infrastructure is stronger. And then whenever we're talking about social capacities, we're talking about mental health facilities and more physicians per capita. And in particular for the regions that have lower competency level, language competency levels, and then higher spatial needs such as disabilities. So, so far I've talked about mobilizing social support to improve post-disaster well-being. But at the beginning of the presentation, I mentioned that social impacts are somewhat disproportionate. So different people are affected differently by the hurricane. And then, as I said, people from minorities and more socially vulnerable people are affected the most. So we did another research to quantify how disparate or disproportionate are these social impacts, right? So, and in order to do that, we this time used 311 call data, which is a municipal service request system that is functional for many cities across the US, Houston, New Orleans, New York, and Chicago. And I used Houston, again, as a case study. So we try to, the 311 call actually stores the service requests made by people with respect to different domains, whether it is waste and debris removal, problem with the utility systems, hazards, road closures. And so we try to measure the extent of the impact of Hurricane Harvey on the waste and debris removal system using the 311 call data set that we have. So basically, and I later on what is the structure, later on explain what the structure of 311 call data looks like. And we try to understand, are there any correlations with the level of impact on people and the level of social vulnerability? And by social vulnerability, I mean the level of vulnerability of people measured by CDC's Center for Disease Control Social Vulnerability Index that measure the vulnerability or quantify the vulnerability of populations based on their disabilities, having very old or very young population, multifamily households, lower education, living in mobile homes, and also belonging to minority groups. So we wanted to see if there are any correlations between the extent of the impact and the level of social vulnerability. But we also try to control for the level of damage to make sure that we are removing and controlling for the level of damage. So for that purpose, I use, again, federal emergency management data. 3 different data sets. One of them is about public assistance, which is for the money and the support provided for recovery of infrastructure systems after disaster. Individual and household program that I used earlier for the 211 call data as well. This is about the support for underinsured or less insured households, and then the insurance program, the insurance data that tells us about the amount of insured losses. So a sum of all these different types of support per capita provides a measure of the damage to each zip code. So this is how the structure of the 311 call data looks. So there are different departments, different divisions, and different service request types, right? So we focus on the solid waste management department, and there are different divisions. For instance, there is a collection division that there are service requests about storm debris removal, about trash cans, about debris in the streets. So we use the number of relevant call topics to the waste and to the solid waste and debris management, and then try to identify the service request. The data also contains the start and end date of the request, right? So we could have the number of services that were active over time. So the number of active service requests is a measure for the extent of the impact of a disaster. So the higher the number of active projects, the lower is the functionality of the system, or the higher is the impact of hurricane on that community, right? So in the next step, I try to normalize the active project with respect to pre-disaster situation to get an insight how well we're doing with respect to pre-disaster situation. And we later took a moving average to somehow cancel out the noise that was in the data without affecting the general trends. So that was the indicator that we used to measure the extent of the impact of hurricane on the waste and debris removal system. And the area under the recovery curve was taken as the measure for the extent of impact. So this graph shows the 4 quartiles, recovery quartiles, and these are the waste and debris management systems. So this is kind of the normalized number of service requests with respect to pre-disaster situation and over time until 6 months after Hurricane Harvey. As you can see, the recovery quartiles are actually distributed all over the Houston area. And in the left-hand chart, you can see the geographic distribution of social vulnerability. As I said, we are looking to see if there are any patterns and if there are any correlations between the extent of the impact and having more social vulnerable populations. So if we just draw a hypothetical line and look at the west side of Houston, we can see that these zip codes have a higher disaster impact because they are related to the lowest 2 recovery quartiles, right? But they have also a higher level of social vulnerability. So there seems to be a correlation here. And also, if we look at the right-hand side of this line and basically east side of Houston, we can see that these are the zip codes with lower disaster impact, but also these are the ones with lower level of social vulnerability. So there seems to be a pattern in correlation between the level of vulnerability and then the extent of the impact. So in order to formally test that, we use regression analysis. So the independent variable was the area under the recovery curve for the waste and debris management system. And the independent variables were the CDC social vulnerability index indicators, and as well as damage, because we wanted to control for damage, right? So this table shows the regression results. And as you can see, 3 variables turned out to be significant at the 99% confidence level. And these are those variables. So we found out that the zip codes that have lower income level, more single parent families, and more multi-unit houses, these are the zip codes that were affected the most by Hurricane Harvey. So there is disproportionate impact of Hurricane Harvey, and they can be actually quantified and measured using 311 call data, which is an inexpensive and convenient way of monitoring and data collection. So to provide a summary of the discussion so far, so in my dissertation, I tried to quantify community well-being while trying to consider the role of infrastructure systems, which is lacking in the social science side of the equation. I tried to establish the role that social support provided by social infrastructure can play in improving post-disaster well-being. Then I tried to identify what are the capacities that we need to mobilize support so that we can achieve our desired level of community well-being. And then later on, that was the result of a CRC paper that is going to be presented in detail later on in March, that there is disproportionate impact on people from different levels of social vulnerability when it comes to the waste and debris management system. So to talk about the merits of the work, I think it contributes to both engineering and social science domains. So it contributes to the engineering domain by introducing a new paradigm, or rather a way of thinking, an approach to consider social factors and incorporate them in planning for community resilience and building infrastructure capacities. And then it contributes to the social science by considering the role of civil infrastructure, other infrastructure systems, and using the phone call data, 211 call data, and 311 call data is actually a way which is with a high time resolution data, but it's rather inexpensive, and you can collect some data in an almost real-time manner after disaster, so that you can monitor different zip codes and then provide support as needed. And then the outcomes can help decision makers to allocate resources in an optimal manner to be able to perform better in the face of future hurricanes. So how can the findings of this research be used, actually? So it can have a potential impact on hazard mitigation planning, because we're considering social factors, and we are also considering disproportionate impact. So hopefully it will end to a more equitable and resilient US the first place, and then probably a more resilient world if it is applied at the global scale. And then having a higher level of research shows that they're having a higher economic well-being, being able to having a higher functionality of services, and having economic capabilities actually incentivize people to return to their original place of residence. So we can use the finding of this research to actually devise some plans to motivate and incentivize return after hurricanes. And then the findings can be disseminated through journal papers, research papers. We're going to present some of those results in CRC. There's a number of journal papers that are either under review or under preparation. So, and this is a new way of thinking that can be actually taught to students that are going to be future engineers and decision makers. So with that, I would like to end my presentation and open the floor for questions. Thank you all, and looking forward to having your questions and thoughts.
Thank you, Ali. Thank you very much. That was indeed a very interesting presentation. And just to reiterate, and as I mentioned during the opening segment of this research, presentation, that this seminar series is being presented in conjunction with CIB, which is the International Council for Research and Innovation in Building and Construction. So, as many of you know, it has a membership in about 52 different countries. Over 3,000 plus researchers are engaged with this organization. So, by promoting these seminars, we are bringing this to researchers all over the world that might benefit and find many of these results to be of interest. So with that said, I see that I was going to ask my first question, but I see Arka has his hand up, so I'll let him take the first question.
Okay.
Arka, go ahead, please.
Yeah. Hi, Ali. How are you doing?
Good.
So yeah, great presentation. So I have one question, which is basically, so my understanding about the presentation is that your community well-being index is based on phone call data as well as the survey data, right?
Right.
And you are showing the temporal pattern of the well-being index and the post-disaster well-being index.
Right.
Now, the cell phone data is collected daily, right? You have the hourly calls or the daily calls, whereas the survey data, do you know the daily outputs or the daily survey data? Or is it like just in one point of time, like after 6 months or after 12 months, after 18 months? So how are you creating the temporal variation? Because one is the daily data, one is like once in 6 months.
Yes.
Or 12 months.
Yeah, thank you, Arka. That's indeed a good question. So the survey data was conducted 3 years after Hurricane Harvey, and it meant to provide a big picture of the longitudinal patterns over time of different factors. So one of them is different aspects of recovery of communities and different kinds of support. So the questionnaire basically asks about these three items on the day of hurricane, 3 days after hurricane, 1 week after hurricane, 1 month, 3 months, and 6 months, and 1 year, 3 year, 2 year, right? So I fitted exponential functions to the data set that we had. So this kind of allowed to have a daily time resolution as well. So basically by fitting exponential functions to each zip code over time, based on maybe 6, 7 observations over time.
Okay, yeah. Okay, yeah, I understand that. So how do you differentiate fitting an exponential distribution from, let's say, interpolating the the time period that are in between your survey responses? Are they different, or are they more like the same?
Okay, so let me try to repeat the question so that I can make sure that I have understood the question right. So you're basically asking if an exponential function is actually fit for the variables that we have, right? Is that the question?
Yeah, that's also the question. I mean, the question was basically whether the exponential curve is different from if you conduct an interpolation.
Right.
Are the outcomes different from that of the exponential curve fitting? Let's say you have, the response after 1 week, and the response after 30 days, after a month. Yes. So one way is we can interpolate the in-between points. You can conduct an interpolation. And the other way is just fitting an exponential distribution to the whole set of responses and then find it. So, did you see any difference in terms of interpolation or exponential curve?
Okay, so let me see. So the exponential function actually was a good fit for almost all the zip codes, right? And in order to answer what you're saying, the interpolation. So the Bayesian network there are different dimensions, right? So if we go back to this directed acyclic graph, which were the causal relations, we could predict social support based on the capacity, different dimensions of capacity, right? So, and those predictions, I did those predictions and tried to see if they match the average level of support reported for each zip code. And there was a really high accuracy. So I could predict the amount of social support provided for each zip code until the time that each hospital returns, right? So this is kind of an interpolation. It is rather geospatial, considering the capacities that are there, particular, specific to that zip code. So I hope that answers the question, but we can discuss more.
Yeah, we can discuss more. So yeah, I have another question, but I will let others ask the question. If there is time at the end, then I can ask another question.
Thank you. Thanks, Sarika. Hold on to that question. Anybody else? Please open your mic and ask a question. I don't see any hands raised. So let me bring in my question as others are thinking about it. So Ali, towards the end of it, you mentioned that perhaps this research is applicable around the world as well. And what additional information might be required to actually make this? Because the data that you have collected is all US-centric data. And including the 211, 311 calls and so on. So in your opinion, what type of data might be required to make it applicable around the world? Because clearly it has significance wherever there are natural hazards and disasters, right?
Right. Yeah, that's indeed a really great question. So so the breaking index kind of consists of a number of different domains and indicators, right? And most of them, I think, is available. It's not hard to collect at the country level for many countries across the globe. Like the number of households that were built after 2000, for instance, or the time that the building code has changed, that can be an indicator. The number of mobile homes, the road density of the road network, and many of those variables, I think, are available at the country level. So I think most of it is applicable to many countries, but it needs to be collected and stored in a unique database. But regarding the 211 call data and basically being able to observe the temporal patterns, I think maybe even building the capacities, building the infrastructure that allows us to have a similar kind of phone call system in different regions of countries. Maybe that can be a good and inexpensive way to collect data about the needs of people in different regions over time. So I think just by providing that system, we can collect the data after disasters or under normal situation even to identify the needs in each region and then adapt the policies based on the capacities that we have and the potentials of each region. So long answer short is that I see it applicable. It depends of our approach to quantifying capacity and then our infrastructure to have such a phone call system, which I think is available in many, many countries.
Okay, great. Thanks, Ali. Any other questions? Anybody? Please open your mic and ask the question. Arka, you're next.
Okay. Yeah, so my second question was related to the use of IHP dataset. So one challenge in that regards is that the IHP is not disbursed to all the disaster affected area. It is only disbursed to the areas where there has been a declaration of a presidential disaster. Then the second part of the challenge is that IHP's approval rate is very, very low. In my research, I have found it's nearly 40 or 42%. So majority of the applicants, they don't receive. Often they don't receive the assistance, and even if they receive, the assistance amount is also very, very low.
Right.
So how do you, tackle this particular challenge of this very low IHP approval rate in terms of assessing the level of damage? Because if you use the IHP, you are not you're possibly not seeing the complete picture, because it only considers a small part of the household that is being that have been damaged by hurricanes. But you are potentially missing some of the other major infrastructure damage or some of the insured losses, etc.
Right. Yeah, that's a good point. But it is 40%, right? And so for the 211 calls, the reason I used FEMA IHP data for damage is that there was a really good match between the topics of the two model calls and some of the FEMA IHP variables. So the topics were closely matched, and then that is why I was more inclined to use FEMA IHP data. But as I showed later on for evaluating the disparities in different regions, right? I use a combination of public assistance, insurance data. So this, I think, can provide a better picture, although not the full picture, but a better picture of the level of damage to different zip codes. So I can maybe do the same to see to apply that for the 211 call data as well to measure the level of damage. And then maybe first, I think just by applying these three components, I think they are highly correlated even. So if we consider insurance data and then public assistance data for each zip code, so there is a high level of correlation between these variables as well. So maybe just taking one of them is a good representative of the overall damage, but this can be further tested and verified. But that was my initial observation whenever doing this research. So does that answer the question?
Yeah, indeed.
But good suggestion. Thank you. Thank you, Arka.
Thank you, Ali, and thank you, Arka, for that question. We still have time for a couple of questions. If anybody has a question to ask, please open your mic and ask the question.
Hey, Ali. I have a question. Could you go back to slide 15, please?
15, sure. Let me go to slide 15. Yes.
I'm sorry, not this one. It's the slide where you showed there's a second decline after 50 days.
Oh, okay. So this is the one, right?
Yes. So this one. So the decline in the community well-being, you said the second decline occurred on day 50.
Right.
So this occurrence only specific for the data you collected.
So could you repeat what was the question? So there was a decline at day 50. So what's the question?
So is it just specifically for this incident? I mean, do you think that other like disaster or other like location decline would be similar or close to that?
Yeah, that's a really good question. So I think it is more the sudden, like the decline, the secondary decline. So the how sudden it has happened. It is, I think, in particular specific to Hurricane Harvey, because what happened during Hurricane Harvey was that there was power outage, and then there was a low level of supply, but there was also at the same time a high level of demand. So demand supply ratio was so high, and so the way that the utility company issued the bills was to measure the demand supply ratio somehow, and so the price of units, kilowatt hour that you used was too high. So and the utility bills were issued after a while, so that's why people started calling and asking for assistance for paying those utility bills. So that's why there's a drop here. So I would say this is somehow, specific to this event, but I would expect that it's going to happen for other disasters, but not in the form of such sudden drop. It's going to be rather gradual. It's spread over time.
Okay, thanks.
I think that was an interesting question. It would be quite interesting to see if we can collect data from multiple different disasters and then compare, what type of results we get, and to see if that is generalizable to what Majid was asking. Any other questions? Please open your mic and ask question directly. Okay, well, while people are thinking, let me throw in my question that I had. So, capacity building is always a problem, right? Okay, before I take my question, Professor George O'Free has a question. George, please go ahead.
Yes, Ali, a really fantastic presentation.
Thank you.
What you've done, because it looks at various areas of knowledge, tries to bring them together. to make some sense out of the data you've collected, makes it very useful. At the same time, also, it gives you a challenge. Because if you're going to, so looking beyond now, if you're going to submit a paper to any journal, you're going to look at these things. There will be scientists looking at it. There will be social scientists looking at it. There will be engineers looking at it. And they will say, why haven't you done this and done that? So I have two questions. The first one is this. For example, you looked at the BRICS index. Have you, in looking at it, and maybe at the end of your work, are you making suggestions as to how this index could be improved? You look at the area of community well-being. Look in the literature and see whether the sociologists have been discussing this, and try and see how they would have defined it compared to how you're defining it. You look at social well-being, and similarly, that is another point. So make sure that you try and cover all these possible angles. I'm not sure whether you've done your Viva and passed, but that is only the beginning, I would say, because in the end, you want to make an impact, you want to publish your work, and they'll be asking you these kinds of questions. So make sure that you cover your ground. That was the first one. The second question is, do you think that FEMA or any of those insurance companies or any of the support-giving organizations would come to you and say, you did this work, can you guide us, or can you maybe come and work for us so that we can improve on what we are doing? But let me also ask another question. So this may actually not be questions, just points that I'm making. The third one is whether works like this are actually going to help us to decide that actually in future may not be wise to build in particular places. Maybe better to knowing what might happen, because there may be a disaster. It may be better to avoid putting our buildings, putting our towns, putting our developments in particular areas, and actually go to places that are better protected. Yeah. So yeah, sorry. So I asked those questions, but I think don't take them as questions. Just take them as points that I thought I wanted to make. But well done.
Thank you. I mean, these are really good and insightful questions. So so for the first question, using the BRIC index as a metric. So just one of the even the infrastructure. So the problem with the BRIC index is that it collects the data every 5 years, right? So there might be a way of including some other factors and indicators and increasing the frequency of data collection. So that's one of the limitations of the BRIC index. So there are some even for the infrastructure capacity domain, there are some factors that are missing. So yes, for sure, there are some areas of improvement to improve even the BRIC index. And regarding the community well-being, so I did a thorough literature review to get an idea how social scientists have done it. Basically, there are a number of community well-being models that have been offered, and but none of them was comprehensive in the sense that they consider the role of services and also all other domains. So they were either lacking one of these domains, either environmental, infrastructure systems, and economic. So there was no comprehensive community well-being model. So I think I tried to use the some 2 or 3 literature review articles, right, that had done an examination and a meta-analysis of the existing well-being models, and use that as a basis to develop to identify first the domains and then the subdomains based on the existing community well-being model. So there is no comprehensive well-being model as such. That is why I have to come up with a comprehensive one. So regarding, does that answer the first question?
Ali, but I think you've done great work. So don't worry about my questions. They just just suggestions. So perhaps let other people ask questions.
Sure. Thank you. So for the second,
Professor Hashtag knows where to find me, so you can talk to him.
So then I know how to find you. Hopefully that would be. I mean, I would be glad to have your feedback and further discussions on the topic. It's always a pleasure. I appreciate it so much. And regarding whether it can be implemented by FEMA, that's the hope, basically. trying to consider socio-economic factors over the long term, and then also considering disproportionate impacts across different, people from socially vulnerable groups. So we wanted to consider all subpopulations and also a wide range of impacts, both short-term and long-term. And I think this can provide a good toolkit that FEMA and such entities can use and identify the thresholds for, let's say, tangible support, thresholds for emotional support and informational support that need to provide it for different hazard scenarios, as I presented towards the end of the presentation. So I think that can be implemented, and that's the hope.
Thank you, Professor Opry. And Ali, these kind of questions only strengthen you for your final defense. So this is great. Very, very good questions.
I'm taking notes of them.
Okay, perfect. Well, any other questions? Comments, suggestions? So let me take the privilege of asking the last question then. And so Ali, I mean, capacity building is always a problem in terms of finding funding to actually build the capacity. And so convincing the authorities that you do need to build social capacity or social infrastructure capacity is likely to be a challenge as well. So, such as social housing or hospitals or any of the other social infrastructure. Do you think that your results might be able to bring zip code communities together to think about shared resources that might actually be more palatable for funding agencies to support that initiative?
That's a really great question. So first, I think that's a good question. So first, I think there needs to be a geospatial analysis to see how those capacities and resources are distributed between zip codes, and whether there are patterns with existing in the level of support provided. Let's say whether zip codes that were nearby, whether did they have similar level of support, those that were closer to each other and perhaps had a higher level of capacities. So that can be actually further explored. I have not explored it yet, but I think that's a good strategy, and cost-saving strategy. And that's the case basically. So many of whenever a hurricane happens, many of neighboring states send out labor, send out support in the form of food, water, and then so search and rescue teams. So I think that's an important addition that can be considered to expand the scope of the work and make it, as you said, more palatable for decision makers. So I don't have the answer now, but I think that's a good suggestion.
No, that's all right. Yeah, thanks. So just in closing, I want to point out that in the last few seminars, we have showcased some of the early career researchers. And as many of you probably know, that CIB has a strong supporting network for, we call them ECRs, or early career researchers. And it's actually free for those who are, late stages of their PhD and early stages of their academic career to be members of CIB. So if those in the audience, if you are interested, you can ask me or find out more about that possibility. So moving forward then, from next week on, we are going to be focusing on women researchers in construction. So we have a whole panel of about 10 to 12 speakers lined up. So please log in next Friday, every Friday from now on till the end of the semester. So with that said, I want to thank all of you. I want to thank Ali for that interesting presentation. And I look forward to seeing you next time. Thank you. Bye.
Thank you.